Hi, everybody. It's good to go ahead and see you all. Today is December 10th, and we are going to be talking about 2027 proposed rule and what's going on in the Medicare market. I am Amanda Brewton. I'm the owner of Medicare Answers Now, and your hostess with the mostest today for the next 2 hours as we talk about what's going on in the environment, what CMS is doing, what the government's doing, what you can do when it comes to all of the stuff that's going on, and then some. So, buckle up, Buttercup. Let's go ahead and let's get started. I am going to actually use a PowerPoint so that way you guys can um, have something to follow along instead of just staring at my face. And let me go ahead and put that in. You should be able to see my PowerPoint now, correct? Okay, perfect. So, one of the things that you will note is that I am going to go ahead and watch the comments on the side so that way I can answer your questions as we go real time. Hey, Michael, it's good to see you. And then we're going to go ahead and start rocking and rolling through it. So, there's a couple of things that I do want to go ahead and put on your radar. One is the Capital Conference. This is NABIP's conference that they do every year. They're actually in their 36th year. This is where you can actually go and talk with legislators. It's how you learn what's going on, how people formulate regulation, how the legislators work. You also have the ability of going to a congressional reception so that you can actually talk with these people that actually affect us in real time. This is one of two conferences that I highly recommend that you go to. And if you have not been, it will blow your socks off. It runs about, I want to say it's 575 is what the member the amount is for the ticket. But this particular ticket, I would highly recommend that you look at getting. Just check it out. It is well worth it. I will be there. There's about 800 to 1,000 of us that are planning on coming from all over the country. It is time well spent. I have never met somebody that said that that conference was a waste of time and money. The next one is Medicarians. Medicarians, I am the hostess with the mostest that will be walking around with Pink Showgirls, but this is my third year doing the creative director position for the Agent Symposium at Medicarians. If you are not familiar with what Medicarians is, this is the industry's largest trade show. And I don't mean that just because everybody seems to do the, oh, we're the biggest, we're the baddest, we're the greatest. No, 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 no. This one is it. We are projecting on having almost 6,000 people show up for this event. And you have everybody from state commissioners to insurance commissioners to CMS to carrier executives to FMO, lead gen people. Your technology is there. It is absolutely amazing. This particular conference runs April 20th to the 22nd. I highly recommend that you come in the 18th to the 23rd so that you can stay for the closing conference concert that is after that. It is back at the Fontainebleau this year, which I am super excited about. And if you whip out your phone and you use that QR code right there, you can get a free hosted ticket. So the free hosted ticket allows you to go. It is like any trade show. You're going to walk miles. So ladies, it's not a time to look cute in your hooker shoes. You want to go ahead and actually wear tennis shoes or professional flats when you go. But this is an opportunity for you to meet anybody that you've ever wanted to meet in the industry. This is where you go to meet them. It is absolutely an amazing event. It is where the movers and the shakers are. And yes, Laura, I did say hooker shoes. We don't wear 5-inch heels to this conference. You will break your legs. But again, April 20th to the 22nd, the QR code is right there. If you go to Medicarians.com, they will go there. We're going to have over 150 speakers at this event. We do a final rule that has had standing room only and at capacity for the last couple of years that we've done it. It's one of the modules that I moderate, and it actually is the one that kicks off the conference at noon on Monday. But highly recommend that you go to that one and bring your team. I will tell you this year I'm actually bringing extra staff that their sole purpose is to identify new software and new trend vendors that we may need to um, look at working with in the upcoming year, getting ready for 27. So I have one of my people doing that, and then I've got a whole squad that comes to be at the expo hall. I take meetings while I'm there doing, and there's several social events and everything else. But I can't stress that enough. Both of these industry events are really, really good. You do need to work out before you go because you will get the shin splints. You will go ahead and be sore afterwards with the amount of walking. Most people do about five miles easy when they're at Medicarians. So, moving into the content, some of you that are new, as I saw, I have at least 50 new people that are on here. They're probably going, "Who the hell are you?" Here's my information. To formally introduce myself, my name is Amanda Brewton. I am the owner of Medicare Answers Now. I've been in the industry for almost 20 years. I'm known for the content and the education that I provide, not only to my agents, but also to the industry as a whole. So my why is to change the stereotype of what an insurance agent is from the yucky stereotype that you see in the news that is just that quote unquote bad actor. But I want to shine a big ass light to all of us that do what we do it well, and we advocate for our beneficiary. And we do it because we're trying to protect someone's grandma. So that is my why. The money comes along the way, and I do run a very profitable and big agency. My agency has been in business for 5 years, and it is several $1 million large. And I do have a couple hundred agents that I work with. I also then do a lot on the advocacy side. I am on NABIP's Medicare Advisory Group. I speak at a ton of different events every year. I travel all over the country. Michael, I am coming to Washington in June. So I will see you there. I'm coming to Spokane. So you can find me all over the country speaking and educating on a variety of different topics. I also teach CE. So that's me. Email is the fastest way to get a hold of me. So jot down that email. It's really hard. It says Amanda at Medicare Answers Now. But that is how you go ahead and you can find me. So what are we going to talk about today? We are going to talk about what the hell is going on in the Medicare world and all the things that have led up to the proposed rule. We're going to talk about all the significant changes with the proposed rule, and we're going to talk about why CMS wants your feedback. They actually want you to go ahead and respond to them and say, "Hey, this is what I think about what needs to happen." So many of you and many of your colleagues have been, excuse the language, bitching for a while about, "I don't understand why CMS does XYZ, and I wish they would change XYZ." Guys, I'm telling you right now, shoot your shot. You have until January 26th to write a letter or submit your feedback to CMS, and we're going to talk about how to do that today so that you can actually tell them what you think and you can provide constructive feedback, and in your world, what you would want to see happen as far as changes go in your industry. So this is a long-awaited ask that we've been candidly waiting a few years for. I'm super excited about the opportunities that lay ahead of us. I know some of you are scared to death based on what happened over the last couple of years, but we're going to talk about that too. So we've got a lot to cover, and this basically gives you the overview of what that is, right? So let's start going into it. So Monday, November 25th, CMS issued a proposed rule. And every year, typically about the end of November, beginning of December, they go ahead and CMS issues a document that says, hey, these are the ideas of what we want to do for the next AEP. So this particular proposed rule that came out November of 25 is actually for AEP October 1st, October 15th of 26 for an effective date of 1/1/27. So, and these are not set in stone. This is them saying, hey, we have a good idea, or we have some ideas on how we want things to roll. What do you think? And at that point in time, this particular document was 465 pages long. It is done in legalese. If you run it through ChatGPT, unless you go ahead and you tell them to not just summarize and look for the highlights, but actually go into the weeds, ChatGPT and Google are going to give you the wrong thing. But what a bunch of us do at MAG or the Medicare Advisor Group is as soon as it comes out, we start reading that whole document. And we start trying to figure out what is happening and what the changes are that they're looking at doing. And we get an idea of, do we like this? Do we not? Are there problems coming in our head, dark skies ahead? Or is there some light coming? And we start formulating that. I need to put a big ass disclaimer on this webinar, guys. This is me teaching this. This is me going ahead and giving you this information. I am in no way, shape, or form speaking for NABIP on this call. The NABIP MAG group meets next Wednesday to formulate what our formal response is going to be when it comes to CMS's proposed rule. None of that has been discussed yet, and that is because Shaylin Jackson, who is the head of NABIP, as well as Nicola Petrie, who is on governmental affairs at NABIP, along with Renelle Nolan from HAFA and NAFA reps, are all at the NAIC meeting, which is down in Florida right now. So, how many of you know what NAIC is? Yes, no? For those that don't, NAIC stands for National Association of Insurance Commissioners. National Association of Insurance Commissioners. Thanks, Tom. So what ends up happening is that twice a year or a couple of times a year, all of the state commissioners get together and they talk about all things commission related. They'll talk about under 65, they'll talk about Medicare, they'll talk about home and auto. They talk about all the things, but it's a way for all of the states to basically compare notes and sound off about what's happening in their given state markets and how it all works. This particular year, there's some big things that are going on right now down in Florida. One of those is that NABIP was asked to go and present there. And then if you have not been living under a rock, you know about the Department of Insurance outreach that has been going on. If you have, let me get you up to speed. So, and it's been crazy because of AEP. So a lot of people have not been watching what has transpired. And what has happened is that it started back in August of 2024. Carriers, WellCare being the first, started announcing that they were going to go non-commissionable with their plans. We all know this, right? After WellCare did that, and then starting into AEP, there were multiple carriers that started announcing we're going non-commissionable on our HMO and our PPO plans for 2025 year. But this started during AEP last AEP, not this past one, right? Well, what ended up happening is that we started looking at it, going, wait, something's not right here. And initially it was there's multiple headwinds, if you will, that were happening in the market. And you need to understand these, especially if you're going to formulate a response to go to CMS. The first one is the Inflation Reduction Act, otherwise known as IRA. We all know that Inflation Reduction Act pulled the donut hole out and dropped the max out of pocket that any beneficiary would have down to this year, it's $2,100, right? Well, when that ended up happening, you have more onus or cost share on those medications to the carrier. The carrier's footing the bill, especially on the people that are doing semaglutides, which ended up being to the tune of $14.1 billion. That's a hefty bill that the carriers are now footing. And I'm not justifying anything, guys. It's all straight fact. So you have a lot of people that are on meds. The Inflation Reduction Act now puts more of that cost share onto the carrier. And then, so that's one piece of the puzzle. Then you have it where you have people that initially they were going ahead and they were saying, well, there's a lot more claims activity. People are sicker, they're on more meds. And a lot of that claims activity that is spiking is also furthering the problem as to carriers and these products not being as successful or making it profitable, right? Well, then there's another piece to that. Sustainable. Thanks, Jill. So then what ends up happening is you have this other chunk of claims issues that nobody saw. And this is the one that I keep shouting off from the rooftops is that you have all of these people that are from 60 to 50, 65 plus as they're becoming Medicare eligible, that they're on insurance plans that have a $5,000, $10,000 deductible, and they need a knee replacement. They need a hip replacement. They need to go get a test done. They need to have some kind of surgery. But because they're under 65 plan that they're on has such a high deductible, they're gonna, I'll let it wait. You know what? I don't necessarily need that right now. I can deal with my knee for another 1 to 2 years and I won't have to worry about it. Well, when that happens and they wait until they get to Medicare, they're Medicare eligible, well, now that procedure may only cost them a couple $100. And it makes sense that the beneficiary does that. This is a cause and effect of the ACA side of this business, right? But more and more of that is happening. So what the numbers show is that the claims data where before those that were turning 65 or becoming Medicare eligible were really healthy and they weren't using the doctors as much. Guess what's happened now? Now they're all using the doctors, but they're not just using it to go get a physical. Now they're having surgeries and they're running into the ER every 2 seconds. And that is blowing the claims out of the roof. So you have that piece of it. Now you have the STARS ratings. How many of you guys are familiar with what STARS ratings are and how they work? Are we good, or do I need to cover in the weeds? Okay. So the STARS ratings, basically, it is a set of measures. There is anywhere between 38 to 52 different items, if you will, on a Part C and a Part D basis that make up that 5-star rating that a plan can have. And they go to everything from, are the people that are on this plan taking their blood pressure medicine and their diabetes medicine? Do the people on these plans, do they have access to care? Are there long hold times to get in to see a doctor? Um, is there any good outcomes over a period of time where BMIs drop? There's all sorts of different things that are in that. And I do a whole different class on the stars ratings, getting into the weeds on how that works. But we all know that a 4-star and higher gives the carrier more money to dump back into the actual plan to give them richer benefits. It doesn't go because, the majority of it doesn't go for bonuses and other things. It has to be by regulation dumped back into those plans. Well, over the period of years, what ends up happening is, especially over the last 2 years, you saw a massive decline of plans that weren't achieving, that had downgrades on their plans. So if they were a 4.5, they went to a 4 or a 3.5. You didn't have as many that achieved a 5-star rating. And the ones that were achieving a 5-star rating were very small regional plans. They weren't the very big ones that have hundreds of thousands of people in them. And that's where that money now that they had gotten used to with all of these richer benefits now comes off the plate. So that becomes another part of the headwind that they have to pull things off of these plans. Then let's add in all of the value-based, the VBID changes. So now they're enforcing that, hey, you know what, that robotic dog that you were offering on this plans, you can't offer those anymore. And the people that get a grocery benefit or a golf benefit, those can't go ahead and be offered unless they actually have a chronic condition. And it is recognized by CMS and you filed your plan to recognize that chronic condition. So there's a lot of these things that ended up happening that it just went, okay, we're giving them the benefit of the doubt. And a lot of people came through and said, oh, well, it's a PPO, zero premium PPOs, which weren't risk sustainable anyways, that are coming off. They're no longer going to offer these plans come 26. Well, guess what happened? A lot of them left. There were over 2 million service area reductions this past AEP, as many of you know. But at the same time, what ended up happening is you had carriers that kept their plans on the market, had no intention of pulling them off, actually had carriers that said we were going after certain market share, so we're going to deliberately go, and then realize that they overshot the amount of enrollments that they were going to take and went, oh, too much, too fast. Let's shut this down on the agent side and make it hard for the enrollments to come in. We don't want this anymore. We changed our minds. It was really shady. And what ended up happening is that there's actually a timeline that we have of 58 different times between August 24 and today where carriers, various carriers all over the country, went to the well to say, nope, we're not, we're either, we're taking these plans off of third-party enrollment tools. We are going to where you can only do it through a Medicare.gov enrollment or the carrier. We're making this difficult, or we're not paying the agent. So all of that to say that, many of you have lived through a lot of this, and I see your questions, which I'll answer them in a minute. But what ends up happening is we see this clear pattern that's happened. And Scott Levitt and the Idaho NABIP chapter went to Idaho, which the Senate Finance Committee chair, Senator Crapo, that's where he's from. So they went to Dean Cameron, who's the director of Idaho, and said, do you see what's happening here? At the end of the day, when carriers go non-commissionable, that means that a whole set of people, us the agents, can no longer quote and enroll beneficiaries on these plans, which then is the very steering that CMS says that they do not want. And it's not us that's doing it. It's the carrier that's causing it because of how things are coming off of all of these third-party tools. We can't email them a quote to even include the different plans, right? So if you haven't watched the YouTube of Dean Cameron, it's published everywhere. I've posted it on social media multiple times. It is very good. I would highly recommend that you watch it. It's about 40 minutes long. But he explains all the different things that he has evidence of that the carriers did to hinder the beneficiary to be able to do the enrollments. So that was the first one that popped the seal of states going, I know this is a federal program, but what the hell is going on here? This is hurting all of these seniors, and this is not okay, not in my state. So as soon as that happened, there were many of us that went to social media and said, okay, guys, we need you as agents to go and do outreach to each of your states' commissioners and say, look at what Idaho just did. This isn't okay. We need you to do the same. So, Jill, I'm going to get there. So, what ends up happening is that we start seeing the agents, and within 48 hours of me posting, I had agents from 28 states, 5 attorney generals, and 3 reporters were all contacted in 48 hours. So thank you to everybody that got in on that initiative, because inside of 3 weeks, we had 10 states 10 states that came in and said, we agree with Idaho. This is not okay. We don't like what you're doing. CMS, what the hell is going on here? At the same time that that happens, Idaho issues what's referred to as a cease and desist. They sent a letter to Pacific Source and UHC that said, guys, you are violating these code rules that we have as a state on how you are supposed to market in these states, and this is not okay. Stop what you're doing. It is absolutely no surprise that the next step was UHC suing and saying, bet me buckwheat, you don't have any jurisdiction. That was automatically going to happen. You also have it where you have several states, like I see in the chat. We've got New York and Connecticut and Virginia that come back and they're like, this is a federal thing. CMS just even issued a letter Monday that says this is a federal thing. We're not touching this. Okay. And that's fine that you don't want to. But what you did and what the states did, and I need you guys to hear me with this, your efforts were not lost on that. It did exactly what we wanted it to do. It put a national spotlight on what is happening in the Medicare market, and it said, there's some shady stuff going on here. CMS, excuse me, I know you're really busy over here on the U65 side of it, but are you looking and seeing what's happening to grandma here? And that is what we wanted to have happen. Because now what ends up happening is the CMS issued the letter this past week. And in it, it says, and I've seen it posted a couple of different times where it's like CMS is saying, this is our jurisdiction, states, you have no place being here. This is our place to play. And here's the rules that the carriers have to abide by. However, the second paragraph that most people are not reading kicks open the door to say, but we welcome feedback about what's happening. That, my friends, is exactly what we wanted. Because then now we can go back to CMS and say, do you know that here's what's happening? And here's how it's affecting the beneficiary. Here's why this is a mistake. And here's what we need to do to fix it. Okay? Yes, it affects you as the small business owner. It affects your commissions. But when the 81, and I'm going to use Jackie Walters' example, when the 81-year-old woman is told that she has to call to do an enrollment on her plan, and then she calls the carrier, and the carrier turns around and says, "No, you have to do this online." And she says, "But I can't. I don't know how to do the internet. I don't know how to use the internet." And the rep goes, "Not my problem." Click. That is an example of what has to happen. Cindy, I'm going to talk about Dr. Oz in a minute and the website. Sit tight. Hold on to that for a minute. So what ends up happening is that this is where now we shift. We started with the states. Now we're going to go federal. This is where the next step goes with what has to happen, guys. Okay? So you have all of the state stuff happening. You have CMS opening up the door going, "Okay, we want to know what's going on." At the same time that this happens, you have the proposed rule coming in. And the proposed rule, for the first time in a really long time, CMS is asking for suggestions on multiple levels, guys. Not just feedback on one or two items. They are asking for feedback on a lot of this stuff. And that is empowering because now you can say, "I work in this field for 30 years. I've been in here. I service 1,000 clients, and here's examples of what is happening to my clients." Share your stories. Share why you are educated with what you do and why you feel that you can sound off. Now, for your clients, that's another piece that I want to talk about. There is a website that I built, and I'm going to pull out of this. Hold on a minute. We are going to go to here, and we are going to go to the website is protectmedicarebeneficiaries.org. And I'm going to put this into the chat so that that way you have it. But this website, it talks about what's going on. It talks about, it has the YouTubes right here if you want to watch them. And I would highly recommend that you watch the two that are here. One is from Chris Westfall with his conversation with South Carolina Commissioner. And then the other one, which is the one that I was just talking about with Dean Cameron. But what you want to go ahead and do is that you have the ability of sending letters, or you have the ability of doing surveys with the simple stuff. Guys, stop with your chatter because I'm going to turn the comments off in a minute. So what you're going to go ahead and do is that there's sample letters here that you can not only send them to, there's agent letters and there are client letters. And then below, it has where you can identify who your legislators are. Washington doesn't know what's happening. They think that they do, but they don't. And this allows you the ability to go ahead and give them some information. The sample letters that are here, these also, they're various different ones. So people that have concerns about their prescription drugs, people that have concerns about not having access to help, it's all right there. And then you want to send those to legislators. Can you guys hear me or did I just freeze? Please tell me I didn't freeze. Okay, good. Okay, so that's the website you want to bookmark is the Protect Medicare Beneficiaries.org. It's the one right there. So here's what I want to go ahead and we're going to go through now, get into the weeds on some of this. But before I do, I'm going to go into some of these comments that you guys had and then answer some of these questions real quick. So the first one, I think for years, turning 65 people were waiting until they got on Medicare for surgery. Yes, it's new because you have you have the rapid rise of the boomers that are coming in. and the amount of people that are inflating those numbers, Melinda, that is why it's new, is that it's such a large group of them that are doing it now, where it's not as much as what it was before, when it comes to the claims and everything. Um, Carriers can pick with their product with their plans where they want to offer them by county. They don't have to offer each plan in every county that is there, and they don't have to stay in every year. There's actually metrics that have to be met in order for them to continue to offer that plan from year to year. So that's where you want to go with that. Let me see. I think I'm almost caught up. Okay, so moving right along, um, when we go ahead and we look at what's going on and in the marketplace and all of that, we're going to lean into the proposed rule now and what's going on with that. So the first thing that I want to do is I want to continue this whole discussion about the TPMO. So for years, agents have gone ahead and been like, NABIP's not doing a damn thing when it comes to the TPMO definition and these call recordings and the disclaimer and all of this other stuff. We live in a society where everybody wants what they want when they want it. They don't want to wait, and they don't understand that any kind of regulatory or legislative change takes forever to do. And it is frustrating as hell, guys. And I can tell you that because I've actually been working on this stuff. Many of you know since 2003 is when I started teaching about the call recording and the mess blew up about the TPMO definition. So it has in essence taken 3 years to get the powers that be to see what is happening in the marketplace and why it is wrong. Here's a couple of things that I'm sure you guys don't know. One of the things that as we're doing all of this outreach to say, hey, the TPMO definition, we're all different people. This isn't one bucket that has us all in the same because we're not all the same people. That's not how this works. As we were talking to legislators and the press and other people, one of the fundamental things that I need you guys to do when you talk with anybody from a regulatory perspective or when you're in your communities is you need to make sure that they understand a plan change is not new business. And some of you are going to be laughing because you're like, dude, that changed over 15 years ago. You're right, it did. But do you want to know every single research firm that puts out the reports that CMS uses was using bad information? Do you want to know that the majority of the reporters that I've talked to in the last 18 months had no idea that that changed? Some of them had the balls to come back and go prove it, and we actually pulled up the CMS documents and said, no, by the way, this is published every year, that plan changes are included in renewal. They are not new business. This is part of what the error is of why people think that we are moving business as much as we are. It's absolutely false. They think we are making $700-800 an app every time we move somebody from Anthem to United, United to Humana, Humana to Cigna. Fundamentally, we as a industry cannot change regulation or legislation until we change how people perceive us. And that means that we had to identify all the bad things that they had wrong because somebody somewhere gave them wrong information. So what did NABIP do for the last couple of years? Change and get loud on a megaphone. Hi, my voice is sore. And say, dude, you got this wrong. And here's the receipts on why this is this way. So plan changes are treated as renewal. Do you want to know when you tell somebody, okay, me moving a plan from Humanity United to Cigna, we get paid $28.94. I don't get paid $700-800 for that. Do you want to know how fast they whip their head around and go, wait a minute, what? I didn't realize that. And yes, Carlson, Dave, that it is. It's considered churning, but I'm dumbing it down, if you will, so that I'm talking on the level that I need you to talk to the legislator, the regulator, or the press, or anyone else that you're talking to. If you use industry words, you're using it and going over their head. So this is how you get them to hear you. $28.92 a month is what it is when you move somebody from a plan change. That helps fix that, right? Some of the carriers are calling it new business. It's new to them. It's new to them. It is not recognized by CMS that. And what you're going to find is that each stakeholder has their own vocabulary. And that is one of the pushes that we're trying to do, is get everybody to use the same vocabulary in the same context. Because everybody, and one of the things that we're seeing is there aren't many people that teach you guys this stuff, which is why I'm doing it, is because if nobody teaches you, and the only people or the only places that you're getting the information are giving you bad information, how can you fix this? And then you have a hamster wheel. And now you get frustrated. And then everybody gets frustrated and becomes a problem. This is why I volunteer my time to do this with you guys, so that you understand how we stop the mess. And the only way I stop the mess is I got to go back to the beginning, explain to you where the holes are, and then give you the plan of action going forward so that we fix it. And those of you that are saying you're not doing it fast enough, step to the damn plate. And those of you that want to join me, come on and let's do this, because we're going to kick some ass. So when we go ahead and we look at this, you've got it where you have this stereotype problem. You have this money issue. The money issue feeds into the TPMO definition. For those of you who have not attended one of my classes before, the TPMO definition lumps lead generators, FMOs, insurance agencies, and a bunch of other people into one definition and one set of rules. That happened back in 2023. We have been advocating for 3 years now to say, you can't do that. You can't dump people all into one bucket. The one bucket happened because when people call Medicare.gov, when the call center rep takes the call and they're using a CRM to track all of those calls, if it's agent related, they all go into the one bucket and they can't separate it out. And because they don't separate it out, when the complaints blew up, the guy sitting behind the desk at CMS went, well, then just put call recording and disclaimers and we'll dump everybody into one bucket, and well, that should solve things. It has taken us 3 years to go to Senator Wyden, who at the time was the Senate Finance Committee chair. It is now Senator Crapo, now that we've had a change in presidents. But we had to spend a lot of time talking with his staff and his organization to draw a picture about how all of these different entities are not the same. So the one of the biggest wins that we had earlier this year is that we were able to go ahead and show them that we were not the same. We also were able to, March 25th of 25, Senator Crapo came out with a new report that actually admitted that, hey, the TPMO definition needs to be fixed. We admit that they're not the same. So I'm right here with this line right here. You can look it up in Google. It was his latest report, and you can read it. And there's a lot of people that read that report and went, oh my God, this is so bad. This is so bad. You know, he's still bashing us, and there's a bunch of really bad things that are out there, and he's out for agents. No, 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 no. He has the same rule that we have. He is one that he wants to go ahead and protect grandma like you and I do, but he doesn't have enough information about what is happening. So when you go ahead and you you look at this, the win that it took us 5 meetings with his staff for him to admit that the TPMO definition is not all the same. So why is that important? Because guess what just happened? In the 27 proposed rule, this is the very thing that they were saying, hey guys, we got to fix this. So if you're not clapping that this is a big ass win, it is. This is what NABIP has gone ahead and NAFA and HAFA have gone and lobbied for 3 straight years to get them to fix. So this is not something where you're hearing it where it's falling on deaf ears. It takes that amount of time for us to fix it. So when we go ahead and going into this, so now I'm going to start working into the 2027 changes. This is where I want you to get out your notepad and I want you to start looking at this, okay? So the timing of the TPMO definition, we all know how much of a pain in the ass it is that you've got to say this disclaimer inside of the first minute, right? It's like, what the hell? I don't even know if they're calling about Medicare. Why do I have to do this, right? Well, guess what? They're looking at changing it. So now you need to go, and they're doing it so that you've got to do the disclaimer before you actually get into the discussion of benefits. So, and they even go one further to say you need to talk about the actual, as it says, CMS clarifies that specific plan benefits, such as under Medicare marketing regs, talking them through an EOC, or how the beneficiaries' cost sharings would work under a given plan. Those are all things that you would need to do a call recording, but you don't have to do it off jump. For those of you that are jumping for 4 o'clock, I will have this posted to my YouTube shortly, and I will route it out on social media so that you have it. The other big win, guys, JAMA did a report about SHIPs. There are only 12,500 SHIPs volunteers in the entire country. That's it, 12,500. They are now, due to the report that JAMA put out earlier this year, they are, which said that, you know what, SHIPs isn't it. They're not effective at what they do. They are not, this is not good. Basically, putting credibility in what we have said about them. And what they're doing is CMS is now admitted and said, hey, you know what? We need to remove the SHIPs people off of the TPMO disclaimer. This is another big win of ours. So Elizabeth says, yes, JAMA stands for Journal of American Medical Association. So this is one of those other wins. We are no longer, we're going to be able to remove SHIPs from the disclaimer. We don't have to have the disclaimer said within the first 60 seconds of a call. And those are huge wins, okay? Everybody good with the disclaimer stuff? What can I tell you about Chapter? One of our local hospital systems was referred to Chapter on bias. Chapter is a broker. They are a broker. They are online and they are a broker just like everybody else is. And that is all I'm going to say about them. So, are these all in effect? So for those of you that came in late, let me repeat. The proposed 27 rule came out November of this year. This is what CMS wants to do and what they think they're going to do. They are asking for feedback about these rules and what you think about them. You have until January 26th to submit your feedback, which we're going to talk about in a minute on how to do that. The final rule comes out at the first week of April, usually. Once the final rule comes out, the rules go into effect on October 1st or January 1, depending on what the final rule says. Okay? So let's talk about scope of appointments. That's another one that's a pain point for you guys. Now, I want you guys to also, I'm going to stop for a quick second on this. One of the things that happened this past July is there was a RFP or an RFI, a request for information, that when Trump, deadline was July. It was earlier in the year. Sorry. Earlier this year when Trump took office, and again, I don't do politics, guys, so check that at the door. This is only about the issues. So what happened is that Trump took office, Doge came in and did the whole house cleaning and everything else. I don't care what your feelings are on it, can it? But what I will say is that one of the things that Doge did is it put out an RFI or a request for information that said, hey, we need to know of all of these dumb rules that CMS puts out, which ones really irritate you guys the most? And if you remember, there was a post that I did, I want to say it was April timeframe, April, May, where I asked you guys, if you could change one rule, one regulation that CMS has that makes absolutely no sense, what would it be? And I had over 300 of you guys sound off on it, and I cataloged all of those. And we took the top 10. I submitted it to NABIT, and NABIT formally submitted a comment letter to CMS saying, here's the top 10 things that we want to fix when it comes to dumb rules that CMS has. Disclaimer, call recording, scope of appointment were the top 3, right? What you are going to see is that in this proposed rule, they heard us. They took all of the stuff that you guys commented on as we were doing as I throw stuff on Facebook and go, hey, I need feedback on this. They took that into account, and that's what we're discussing now. So again, it's not falling on deaf ears. And the social media creators that are going, oh, well, nobody's doing anything and they're mix mastering, guys, they're a part of the problem. They're not a part of the solution. So going back to, because somebody squirreled, and Rachel, I love you, but stop squirreling and pay attention to what I'm talking about. Carriers and their hospital contracts, that is a whole act of Congress that has to be done. That will not and cannot change unless Congress actually passes a brand new bill to go ahead and fix it. So flipping back into this information and the proposed rules. So now let's talk about scope of appointments and how much of the wins that we have here. So 48-hour rule, they want that to go away. They also want to make it that if you are with a husband and a wife, you have the ability of only having one scope for the household instead of it being where you have to have 2 individual pieces of paper for that same household. You also have it where if you want to go, if that particular scope of appointment, they want to know, is that working for us? Is that something that makes sense for us to do it where it's a group and we get rid of the 48-hour rule? Personally, that's a good thing. We want to tell CMS, yes, we want you to do this. We think that this is a smart move. This is the one thing that I want you guys to see. They are also saying that for an in-person scope, it needs to be in writing. If it is a audio or an online appointment, they need to have it where it's an audio or an online scope in it or a written one. It can be any of those. The change on where you can collect scopes is also changing. You can collect scopes again at educational events if this passes. You can do it at marketing events. You can do it at activities that are in healthcare settings as long as it is in the common areas. You cannot do them as an iSNP. What they want to go ahead and do is they want you to go ahead and give them feedback on what you like. So Carrie Ann, you prefer that they get rid of it totally, but you're happy with the 48 hours? Tell them. And in writing, yes, that means you need it in a paper scope. Other things that you need, because they're actually going to change what a scope is. Okay, Tara, if we go back, you can now, what they're looking at doing is having a scope of appointment that you collect at educational events again. And they're saying that if you have an in-person appointment, you need to have your scope in writing. So you need to have a paper scope that they have actually signed off on. Again, these are proposed. This is not set in stone yet. Karen, you're getting too ahead of me. Sit tight. So when we go ahead and we look at what's required, so they're going to change what is considered a scope. Business reply cards, voicemails, online forms, and other requests that identify the product can be treated as a scope of appointment. So they're actually changing what can be used as a scope. So that also is a win. Tara, that's exactly what I'm talking about. It's a proposed rule change. So, as this says, they want to remind that scope of appointments, business reply cards, and other requests for information are going to be valid for 12 months from the signature, only for the plan year. So you can't take a scope of appointment that was done in February of 25 and say, well, this is good October of this year to talk about 27 benefits. Nope. It's got to be a new scope for the new year. That's how they're going to do this. So, as a heads up, as it says, a signed scope can be used for multiple contacts or appointments, but you cannot cross the stream on the 12-month window when it comes to plan year. Jill, look at the bottom one, the bottom bullet point. It's what I just read. So it can be used for multiple uses, but it has to be for the same calendar year product types. So other things that they're going to do, now we're going to talk about, will it be reworded? Yes, that's actually how you want to teach it. If these things pass. So all of the things, if you were in favor of all the things that I talked about in the scope, which I am, you want to say we like all of these things. These are all really good changes that you guys are doing. Yay, you got it right. Thank you. If you want to go one further and get rid of scopes, even better, but we like where you're going. You're moving in the right direction. So now we're going ahead and we are talking about marketing events. So Mike, stick with me. So what we're doing here is that we are going to remove the 12-hour rule between an educational event and a marketing event. You now have the ability of, as long as there is a reasonable break so that people can leave, you can reset the room, and then you can go into sales activity, you will have the ability of doing them back to back like you used to a couple of years ago. You can also collect scopes at those events as well. So super big win here as well. It makes doing business much easier. Next piece that they're looking at doing, the superlatives. So they're going to go ahead and change it where the plans can now use, we have the largest network without having to cite the information. However, CMS reserves the right to go ahead and say, prove it on what you're doing at a later time. Next one. Now let's talk about call recording because this is a big, big deal. This is one of the things that CMS or that NABIP proposed. We don't like, and we've heard for years, how hard and expensive it is to store audio recordings for 10 years and how much of a pain that is. So what we proposed, we being NABIP, was that CMS shorten it to anywhere between 3 to 6 years. HIPAA rules are 10 years, but lessening it made sense because what we've seen, and I know being a carrier rep for several years, is that most compliance stuff happens in years 1 to 4. It doesn't usually happen anytime past that. So it makes no sense for the agent to house all of this stuff for that long. So now what they're looking at doing is they are looking at saying you have to keep your enrollments, your applications and things for 10 years, but all of the marketing and the sales calls, you can get rid of those. And that is a big one. They're also looking at having it where if they implement this rule, everything that you've been holding on to, you can now get rid of anything that is sitting from year 10 to 6, right? So super, super cool opportunity here that we want this to be able to happen, that we no longer have to hold these records for this amount of time. It makes no sense. So yes, the technology right now on iPhones allow you to record your calls on your iPhone, but the storage capacity of those sales calls is that you still have to download them and then upload them into your CRM and then hold them in your CRM for 10 years. This regulation shortens that, so then you only have to do it for 10 years. But wait, there's more, guys. They went one further and said, you know what? We're considering going 3 years. Rather than waiting 6 years, we want to know what you think about us reducing it to 3 years of a retention. And what if, because there's all of this new AI technology that can do a written transcript, what if we require you to go ahead and keep the transcripts rather than the audio? Is this something that is an option? This particular screen, guys, is the one that I need you to respond back to. This right here is so, so important that you do, because this can save us a lot of time, a lot of headache, and a lot of money. Okay? So I'm going to talk about where we do this in a minute. I'm almost done with going ahead and talking about the overview, and then I'm going to show you guys how you do your letters, what you do, and all of that fun stuff. So the next thing that we go ahead and they're looking at doing is that they created a brand new separate RFI that says, CMS says, I want specific comments regarding how long you keep your records, what kind of ways do you want to keep those records on a transcript, whether it's call recordings, whether it's a hybrid model, whether there's new technology to monitor interactions. What is it that you want? Whether we need to remove the recording requirement entirely. Hello, you all want to get rid of the call recording, right? This is where they're asking you, do you want to get rid of this? Yes, please. What the burden is from the cost perspective. So you want to tell them, I have to pay extra money for extra storage on my CRM, and it's going to cost me an extra $100 per user, per member, per month, or per user per month to go ahead and store this stuff for what? Because you're not going to use it. And then what you're going to need to do is you need to send this to this email box, which I will reiterate. It's CMMI space MA strategy at cms.hhs.gov, but it has to be done by January 26th. So this is huge, right? So now comes the fun part. Whip out your phones, take a picture of this particular screen for me. This is where it's going to show you how to submit your feedback for the proposed rule and everything else. I'll go back a minute in a second, but take a picture of this. Thank you. I'll fix it in a minute. Actually, let me. Damn. So here's the other one. So the letters, Julie, I'm going to talk about your clients. Let me get through the agent side of this first, and then I'm going to talk about the clients next. So I want to break this off very carefully, and we have more than enough time to talk it through. So this is where you put this information in, and then here's the CMS information. Okay. Some of you on this call are probably going, I have never written a letter to Washington, D.C. in my entire life. You are asking me to do something that is so far over my head, and I'm scared to death. I'm not doing this. Some of you are probably going ahead and doing okay, I want to do this. It scares me, but if you show me how to do it, I'm happy to do it. And I'm okay with going ahead and walking you through that. And that's what we're going to do now as I'm talking you through this. So let me put this screen back up because somebody wanted to grab it. So here's the screen again. So here's what you're going to go ahead and do. I have sample letters that I've written. I am going to write my letter probably within the next week, and then I will post that so that you guys can see my letter and then use it as a baseline. So the calls are something totally different, Jennifer. Stop squirreling. Stay with me. So when we go ahead and we're talking about these letters, a couple of years ago, we had to do a outreach campaign like this, and I was called a fearmonger. I was called all sorts of names about various things that were happening. And Danielle and I did a call on how to do these letters. And CMS has flat out said they will not take a form letter. They will not take a petition. You send either of those, it's going to go straight in the garbage. This is why I have not provided you with a sample form letter that you can reach. It's also why there aren't Operation Shouts or something that are sent, because they do not work. They make you feel warm and fuzzy because you half-assed it and it took 30 seconds to go ahead and put your name in and hit send, but it's not actually doing anything. What I recommend that you do is write your own letter. And when you do this, what you're going to do is you are going to, and you'll be able to pull this up to do the replay. You'll be able to go ahead and sound off on any number of things that you want to talk about. Here's the things that are the do's and don'ts with this, okay? One, this deadline is the deadline. Fast and hard. January 26th at 5 p.m. They must have your information. Not the next day, or postmarked by that date, it must be in their hands by January 26th. And since y'all, I want to make sure that you aren't doing something. What is that magic date? Put it in the chat. There we go. Okay. So, what I want you to do is you are going to write a formal letter. And some of you have probably never done this, and that's okay. I'm going to hold your hand as we do it. So, what you're going to do is you are going to send a letter, address it to CMS. You are going to start out saying, how I write my letters is, hi, my name is Amanda Brewton. I am an insurance agency owner out of Cleveland, Ohio. I have been in the industry for 20 years. I teach thousands of agents across the country about how to work in this space. And here's my feedback regarding the proposed rule. And then you are going to section it off by each piece that you want to discuss. You are going to lead by all the things that CMS got right. Don't attack them first. It's going to go in the garbage. Lead with what you like. And I just gave you a bunch of it. You like the scope of appointment changes. You like the call recording changes. You like the TPMO definition changes. You want to go off, you want to sound off on what you like. And then you're going to change it. And then the other part of the letter, you're going to say, and here's my feedback that you've requested on how we get better. And this piece that you're talking about on the call recording, well, you know what? I think it's great that you're going from 10 years down to 6. But ideally, I'd really like it if you did it at 3 or at nothing, because this really doesn't make any sense. And if you are going to change the TPMO definition to splice out what a call center is versus what an insurance agent is, then hold the call centers responsible for call recordings, not the person that does business face to face. You want to give as much examples, street level examples. Show how it impacts your beneficiaries as much as possible. You want to show how some of this stuff is causing problems. You want to show the effect that it has. And if you want to include senior letters, do that. You also want to send a copy of this letter to your legislators. So what you're going to do is go back to that website, protectmedicarebeneficiaries.org, say, find my legislators, and it will give you who your senators are and who your House representatives are, and you snail mail them the letters. Why do you do this via snail mail? Because then I don't have to worry about it being in junk. I don't have to worry about somebody automatically deleting it or somebody somewhere doing some dumb stuff. Nobody sends paper mail anymore. And guess what? When paper mail comes, everybody opens it. So send it. It's a good way to get somebody's attention. When you are talking about the unsolicited calls, I am doing training on the unsolicited calls because that is a whole other discussion. And that runs through the FCC. It does not run through CMS. And what you want to do is that is where you need to teach your clients how to submit complaints to the FCC. You need to send letters to your legislators saying, I've been teaching in my communities for the last 2 years that I've had this program out on doing the do not call list. I have seniors who get up to 80, 90 calls a day. And here's the problem with what's going on. You need to stop this. And here's the examples of what is happening. Congress has to fix that. That is not a problem that CMS can fix. It must go through the FCC and it must go through Congress to be able to fix it. And some of you are going, well, it's offshore. They can't fix it. Yes, they can. They went after the auto warranty people for hundreds of millions of dollars. They went after the under 65 lead gen offshore people for hundreds of millions of dollars in the last 2 years, to the tune of over $400 million in fines. Don't tell me they can't do it, because they can. The trick is giving them the information to be able to do it. And the more that you turn them in and you arm the FCC with the information, the more that they can go after these people and see if it's one particular organization or if it's actual stuff that has to happen. So when you are submitting your CMS feedback, be constructive with it. Shoot your shot, anything goes. The system is broken entirely. One of the things that they flat out are asking, how do we stop the bad actors? What has to happen? My personal position on this is this. For many of you that don't know, HHS, Health and Human Services, is overseen by Trump, then RFK, and RFK put together a healthcare advisory committee that they requested. The RFP went out in August for nominations of people that could possibly overhaul the entire, any federal-based program that the government has. Medicaid, Medicare, CHIPS, all of them. I was asked to throw my hat in the ring and to submit a nomination for that advisory committee. There are 15 slots available. I got an email back yesterday. They are still working on it, and the goal is to get that particular committee up and running by the beginning of next year. They are also taking all of the submissions of the people that were nominated in, and they are looking at building superpower subgroups. So I'm hoping maybe I get on one of those. In addition to the MAG work, there are several people that volunteer their time to actively go to DC to advocate on your behalf. Dwayne McFerrin, Chalon Jackson, Danielle Kunkel-Roberts, Galen Hendricks, me, Jameson Keller, Calvin Bagley, Samantha George, Zachary Freeman, Tanya Bell, Ed Etsy, Brian Billarts, and I'm sure Shawnee, and a few others that are on MAG. And that is a 1-year term that you can do actually for I believe it's 3 years, 4 years, to go ahead and help affect change on the NABIP front as well. I know HAFA and NAFA also have subgroups as well. If you don't follow me on social media, I highly recommend that you do, because that's how you can stay abreast of what is happening and where we go and how we do this, but you want to get involved. CapCon is one of those where you're able to hear about what we're doing, the successes that we have. I will tell you that we wrote model legislation to put protections into place for commissions and to stop the steering that the carriers are doing. I will also tell you that MAG had meetings with the Senate Finance Committee and with the House Ways and Means Committee staffers last week. When we talked to them about the 58, the timeline with the 58 instances of the non-commissionable, and we talked about the model legislation and all of the changes and the things that are happening. They wanted to know more. They wanted to look at it. They want to see and get a better pulse of what is happening. That tells me right there that what you and your clients can do, because they care about the constituent, the voter. That's the one that's going to keep them in office. So have your clients mail something into their legislator in DC, because all of that gets cataloged and everybody starts taking a look at it to be able to move forward with the information. And that is how you help. So again, their sample letters. You can have them send their letters in about the Part D costs. You can have them send their letters in about the games of chicken that the carriers and the hospital systems play when it comes to network negotiations. You can have, this is where we do this, guys. And if we all band together doing it, we can affect the change. It ain't going to happen overnight. It takes a lot of time, a lot of effort, and a lot of consistency. The other thing that I will tell you is go to other agents that you are around. One, have them follow me. Two, say, you know what? If you don't like it, get involved. And I don't say that, I've been, granted, I'm overtired and overstressed, but calling people out lately, that's what I've been doing. What are you doing to help the situation? If you don't like it, what are you doing? And I've spent the last 18 months educating so that you all have the tools to be able to arm yourselves to help yourselves and advocate for yourself and your business and your client. I am happy to help anybody that steps to the plate. I can tell you I have fielded emails at 11 o'clock at night. I have dealt with the tears of agents that are scared to death at 6 in the morning going, Amanda, what am I going to do? I'm going to lose my agency. I am here to help you. You are not alone. You are heard. But tell anybody that goes ahead and that is actively sitting there on the sidelines, step to the plate. The other thing that I will tell you, and I need you guys to hear this as well, you are guilty by association when you are a part of groups and when you say things that make it look as though you are only and solely money focused. We all have a business. We all need to make an income. We all have families to support, right? But when the stereotype is that we are money grubbing agents that will screw grandma in a heartbeat just to go ahead and get ours, if you are associated with entities that all they're focused on is money in their titles, that's a problem. If you are going ahead and you are witnessing other agents say, I'll give you an example. I saw in a Facebook group where someone said, let's talk about getting over obstacles. What's your response to, you drive out to somebody's house, you drove an hour out there to sit with somebody to do an enrollment. And that person tells you, I need to check with my wife before I enroll. What do you do? So I watched the thread. And one of the responses was, I asked him if he's a grown-ass man and does his wife make all of his decisions? Is that appropriate? How do you think the press would take that? Another answer is I've gone ahead and I just took all of this time to come out here. I'm not leaving without an application. I'm getting mine. Is that appropriate? Another example. I mean, and I can go on and on with that. When you see that stuff, if you don't say something and you just go, oh, I'm staying in my lane because that's none of my business. No, it is. Because it's staying quiet that got us to the point where we all look bad. And I'm not having it. I work too hard to protect the livelihoods and to have it so our reputation is that we are doing good, and the majority of us do, to let some little pissant that needs to think like that, which is short term, decimate us all. That's the problem. So I'm going to go one further. The next thing is that I promised Cindy that I would go back to the comment about Dr. Oz and Medicare.gov, and that brokers are going to be, brokers are going away. We're all losing our job. You better sell now because it's all going away. Guys, there is so much business out there and there are so many people that are in need of help. There isn't enough technology, call centers, agents, ships people, carrier people around to help them all. There isn't. What Dr. Oz is doing is he is trying to get CMS into this century when it comes to technology. He wants to get it so that CMS is actually usable and not an awful website that is so hard to manipulate and use that it makes no sense. Years ago, agents used to use Medicare.gov, and then they did an upgrade and said, nope, not for you. Well, now they want to go ahead and look at putting it back. There wasn't, and these RFIs that I keep talking about, how you find them is CMS puts out a press release. And every press release that comes out, you can even sign up for the notifications. But those press releases that come out, I watch every single one of them because at some point, one of you guys is going to ask me a question on it, or I'm going to have to be on a stage and some idiot in the room is going to want to make me look like I'm an idiot. So they're going to try to get me on a zinger, and then I have to be on it to be able to answer the question. Happens every time. But this particular RFI on the Medicare.gov, they are deliberately trying to overhaul the Medicare.gov website. They want it to have more functionality, better information, have it to where people can understand what's in it. You and I both know that it's the government. They're going to do a piss poor job again at it, but at least they're going to make the attempt. But one of the things that they're also looking at doing is they are actively looking at making a section of Medicare.gov specific for agents and brokers. So it's not that we're dead in the water, guys. Things are shifting. How you save your job is do your job well, be a resource within your communities, know what's happening, and be that person that comes with the receipts so that you can say, you know what, I heard the same thing, but that's not actually true. And here's where, and cite your source when you talk with them. Build your business. It is a relationship business. Sales has always been a relationship business. It is not something when you are talking about life and death with somebody's healthcare. There is some people may leave that up to AI. Some people may leave that up to the internet. To each his own. But the majority want to make sure that they're not going to accidentally put themselves in a plan that ends up screwing them so that they can get the treatment that they need when they have cancer or anything else. So you want to be able to be careful with all of that. So I've got a few questions. So let me go back in here and look at this real quick. Again, you want to help me, tell your friends, tell your clients, or tell your colleagues, tell anybody that you talk to follow me. I do all sorts of content. I am doing the FCC thing. You can put your questions in the Q&A also. I'm going to clear out the chat and then I'll move to that for the next 30 minutes. You used to be able to save the RX list. Yes. Right now, you cannot do it. Your client has to set up a profile, and that is a PHI. It's a HIPAA violation as to why they said, no, you can't do that. But your Smart Enroll and your Connecture or your, My Health Plan or whatever it is that you're using that ends up making it too. Call out the mess with the Part D stuff. So when you submit your feedback, you want to call out how time-intensive prescription drug, how much time you spend evaluating drugs. That the average 90-year-old or the 75-year-old doesn't know the difference between a tablet, a capsule, a solution, and a patch, and how to pick the right one. So that becomes a problem. And they want to be careful about it. You want to talk about how There used to be 50 some odd plans that were available, and within 5 years, we're now down to two. All of those things need to be bright lights that are there when you're looking at it. Jackie, is having the agent and broker apply through Medicare.gov a reality? Yeah, it's a possibility. Um, okay, so going into the Q&A. Hold on. Answered that one live. Can you comment on the pilot proposal with MedSup? Okay, so you're talking about Wiser. Wiser affects 6 states, Ohio being one of them, and I'm not going to rattle off the other ones. But what it is that there is a lot, and I mean a lot, of fraud in original Medicare. Original Medicare and MedSups are sold on the premise of there's no network, and you can go to whoever you want, whenever you want, and they're going to get whatever's Medicare allowable covered without any kind of red flags anywhere. We know this. We also know that there's 2 spots in the industry that are known sources of fraud. And then there's a third one that Weiser's going after. The top 2 are DME, durable medical equipment, and skilled nursing facility for fraud on original Medicare. This is why skilled nursing facilities don't want to tell the daughter or the son of the person that just fell that can't be left in their house by themselves because they've set the house on fire 4 times that, hey, your insurance isn't going to cover it, but if you go to original Medicare, we can keep her here up to 100 days and then spend her down so that she pull all of her assets out. So then she gets on Medicaid, and then you're actually, you have a place to stick her. Because I know you don't want to bring her home. And I know you don't want to take care of her, or you can't. That is fraud, guys. We all know custodial nursing facilities are not covered under Medicare or any kind of coverage. This is a hard thing for people to take. So the nursing homes have found that loophole, and a lot of them do it. The other one is with DME, diabetic supplies. We all see it. It's all over the news. Department of Justice goes ahead and has that come up all the time. Those are 2 sources of fraud. The next one that they're finding is that people are going ahead and that bad actor hospital systems and providers go, and what they do is that they come in and because that client says, well, I saw on the TV that this medicine is what I should have, give it to me. No, you need to go ahead and check these 20 other meds first before you get on the one that costs $100,000 and is the new latest and greatest cholesterol pill. No, but I want that one. Or I want this procedure because it's the thing that I saw on TV in an ad, and it's going to go ahead and make me drop 100 pounds so that I can be skinny, and that's what I want, and you need to give it to me. Right now, those rules are not in place on original Medicare that say, did you try nutritional therapy? Did you try exercise? Did you try this? Did you try that? Before we go to the expensive option? None of those measures are in place with original Medicare, and that is a problem. So this prior authorization that Wiser is setting up is they're saying, guys, in 6 states, there's this handful of procedures, and it is a handful of procedures that are known for having fraud in them. We want to go ahead and put into place these rules for authorization to have those procedures done to forget this fraud or to minimize this fraud. That's what Wiser is. And personally, I am all for it. I think that the sustainability of original Medicare without those kinds of measures in place is to the taxpayer's detriment and to the beneficiary's detriment. So I am for it. I think that Medicare as a whole has to evolve, which it will in the next couple of years. And this is one of those things that has to happen. Um, Wiser does not get compensated. Wiser puts the money back into the government Medicare program to prevent it from all of the spends that are happening. And it does not get comped based on the number of denials. It is a demonstration program with the technology to explore for a couple of years how much of this dumb stuff that they catch. And they don't even know how bad it is because they don't have a control on it right now. So they're testing it with a couple of states to see, okay, is this really a problem? And how much money can we save by putting these measures in place? Because there's dumb things being submitted for bills and procedures that either aren't really happening or shouldn't be happening. That's fraud. Um, okay. It was not tabled for 26. They just went ahead and started outsourcing the companies that are identifying who the companies are going to be for it. So they're still working on it, but it is not a hard no that they're not going to launch it. Birthday rule. Birthday rules are very, 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 very bad. They are going to blow med sup affordability out of the water. They are also going to minimize the number of med sup options available. I am not for them. Every state that birthday rules and guaranteed issue has come into play, it has been to the detriment of the beneficiary. Some states have seen as high as 65% year rate increases and multiple carriers pulling out. I'm not a fan of birthday rules at all. It sounds good, but it is awful in the end. Um, okay. I am actually 20 minutes. Are there other questions that you have? I'll open it up for other questions that you guys may have. Depends on the state, Carla, how the rules are set up, but usually it's where a state, someone that's on a med sup has a GI at their birthday month to be able to move to another plan. So then you have adverse risk going ahead and moving to different plans, and it becomes a mess. That's basically the quick version of how that works. Part D penalty, and late enrollment penalties, they are not going away. They actually use the Part D penalty and the IRMA money to help fund the subsidies on the U65 side of it. That was built into the ACA rule. With that being said, it is definitely one that I know that there's people that look to they want to get rid of it. I don't know that that's actually going to become a reality. Do I anticipate continued withdrawal of commission into this next year? I think it'll level out for 27. But I do still, how we had announcements as of it was funny. We met with Senate Finance and the Ways and Means people, and literally 2 hours beforehand, we got an announcement from a carrier. So that and the change was going into effect the next day. So it was less than 12 hours worth of notice. So it gave us a very good example to go, this is what they're doing. They just did this and they gave us less than 12 hours notice. So I think that the louder that we get with this is going to be a good thing. because we do need to show the ramifications of what this does and how it hurts the beneficiary. What are my thoughts on standalone commission trends? There's no money in standalone drug plans. So, candidly, I really don't think that the viability of those, unless something changes or unless the carriers are mandated to pay for it, I don't know. I don't see that being something that changes. I wish it did, but I don't see that. I don't see it as such. Um, what about carriers terming contracts for enrolling in mirror plans? That's one that we have to get evidence of it, and then we have to fire that up to CMS to say, here's evidence of what carriers are doing. I will tell you, there are carriers out there that you get more than three compliance investigations in 6 months, they'll term you. I know that some that if you get six in 12 months, they'll term you. And there's been some widespread terminations of agents for those types of things happening now. That's been happening since November. Are there any groups that support us agents? Tammy, good question. As a matter of fact, I have a couple of them. One of my groups is on Facebook is Medicare Marketing and Motivation. The other Facebook group that I have that is women only is Ms. Medicare. If you are talking about professional organizations, there are three major ones. One is NABIP, which is National Association of Benefit and Insurance Professionals. NAFA, which is National Association of Insurance and Financial Advisors. And then HAFA, which is Health Agents for America. So there are quite a few. Let's see. Is it legal for carriers to change comp mid-year? Right now, the way that CMS has it filed, carriers file it as a range, and it is a range for everybody, where it actually needs to be spelled out. An employee of the carrier makes X, a independent agent makes X, so that it isn't a range. It should be spelled out. Instead, now it's a one size fits all. Do I recommend we stop doing PDP? One, check with your E&O, but I recommend doing it just for customer service. Not all E&O is treated the same, so you do want to check with your provider to make sure that you, as long as they are a client of yours, you are covered under your E&O. And then I would do it because the amount of referrals when you tell them, hey, you know what, I don't get paid to do this, but I'm going to do it to help you, and then tell a friend. Um, you'll get additional business out of it, so it just makes more sense for you to be able to continue to do that good customer service. I am a big fan about the little things, and this how you service them that comes to you back to you tenfold. So I highly recommend that you do. Let's see. David, thank you. I appreciate the note. Some days are hard. So to be acknowledged for the work that I do and for the time and the effort and the energy. There are days where people yell and say, why aren't you doing enough? And you're not doing enough. And what you're doing is stupid and you can't fake change. You can't affect any change. And then that usually I cry for a minute and then I get pissed off and I go, watch me, hold my beer. Because don't tell me I can't do it. I've affected more change in this industry than a lot of people. I'm not the only one that has, and I don't do it alone. And there is strength in numbers to what we do. And if there's one thing that, as a leader in this industry, that I want people to see, one is I care about you guys as well as I care about the clients that you work with. And I also am one that I lead by example. I'm not going to tell you that it's all roses. I'm not going to tell you that I don't struggle with certain things because I do. Um, and today's a hard day, actually. But it's also where I want to lead by example and go, if I can do this, you can do this. And look at what I've been able to do in 5 years. Look at what I've been able to do in 20. Look at all the different things that we can do to affect some change. And I would rather empower you and show you how to do it one baby step at a time and arm you with the knowledge than have it where you look and you sit on the sidelines and go, I can't. I can't do this. I don't know how, and this is bad. It's real easy to say I can't, and it's real easy to play a victim. When you actually step to the plate and you actually affect change and you use your superpowers for good and not for evil, the amount of change and the empowerment that comes along with it, I cry like a baby. If you come to Medicarians, you will see that. I make a point to meet each and every one of you for 2 hours. I will stand there and meet everybody in person. And for the next 3 days, I will work 16 hours in front of people with all of the stuff behind. So I'm getting like 2 hours of sleep. But I will take the time to have the conversations. And I try to be as approachable as I can, even though some people tell me that I scare the hell out of them, which I'm a mess at the moment. But oh, by the way, I will bring out my gears just so that you see them. This is how I run some of my staff meetings, is with my Mickey Mouse ears. But I want to show you what's possible. I want to show you that there's so many things that so many of you can do. And it may not happen right away, but if you plug at it, you'll get to where you want to be. And that's my soapbox. So I hope that I see you at CapCon. I hope, which is February 22nd to 24th. I hope that I see you at Medicarians. Get your free tickets. And please make a point to come see me. This upcoming year, I will be in the following states. I will be in Cleveland, which is where I'm based. I will be in Spokane, Washington. I will be in California twice, once in San Diego, and I believe I will be in LA. I will be in Arizona, Fort Lauderdale, possibly Orlando. Oh God, where else am I forgetting? CapCon, Atlantic City for annual conference. And I think there's a couple of other ones, but there's like 26 or 27 different or there's 15 different speaking engagements that I have, not to mention everything that I do online. So you will definitely see it. Um, Considering the birthday rule isn't the same as no underwriting for MAs. You're right, they are not the same. It's different. Are there any talks of removing Part B penalties for veterans? That is a discussion. It just hasn't gotten a lot of drive to it. Um, oh God, what is his name? The guy that runs Advocate. He's the one that's spearheading that with Better Medicare Alliance, Michael. That's who you want to connect with. Trisha, thank you. I appreciate it. Let me see what else I've got. Oh, I got a probably off topic. Is there a place where FMOs can be called on bad business practices in regard to their own downline? Um, you can talk to the carriers about what you have happening and provide feedback. Make sure that you have some evidence with it. I can tell you right now that I have a couple people that will tell you that I'm an awful FMO, and I can then come back and tell you, and they're doing it publicly, and then I can turn around and also tell you that I've spent thousands of dollars in marketing with them and all sorts of things. And if you listen to them, they will tell you that I haven't done shit. So, you got to be careful there because, take that. Um, there was no mention for proposed SEP. I didn't have enough time, Jill. There were quite a few of other things that were there, but yes, they did do a proposed SEP for network providers so that if you have a larger group, then that way you're good to go as to what that looks like. Thoughts on PDP premium trends? They're going to continue to escalate. It's going to continue to get more expensive. What's my opinion on how testing AHIP and all the carrier testing could be changed into one test at some point? Here's hoping, but at the same time, the amount of rudimentary questions that elementary questions that I get asked on a daily from agents that tout that they've been in the business 10 plus years scares the hell out of me. So if I'm still getting questions about what is covered under Part B and you've worked in the industry for 10 years and you're still, I mean, it's right there in the AHIP, and you still don't have those answers. I don't know that I want to get rid of the testing that would still make sure that you're still trying to go ahead and get some of this by osmosis. We've got to figure out how to weed them out. But some of these questions that people ask scare the hell out of me. What CRM do I use? I use Agency Black. That's my preferred one. Um, see what else. Thank you for all the comments and the notes. I appreciate it. Again, follow me on social media. I am going to go ahead and Mike, you didn't have an idea of what I do. Well, now you do. Now you have to go ahead and come stalk my webinars regularly. You'd be surprised. There's a lot of fun stuff. For those of you that don't know, Mike that I'm talking to is Michael Drake out of Washington, and he and I used to work together at Anthem. And for those of you that are new, that are like, this chick talks to people while she's teaching, this is insane. Oh yeah, I've done it up to 1,000 people on these calls, and I'm talking with them at the same time that I'm teaching. It's important to me to make sure that I am on point with what you guys learn and that I'm teaching in an effective way, that it's not going over your head. So it's very important to me that the time that you spend with me is not one that you're walking away going, that was a waste of my time. It has always been one of my fears. So for me, this is a way for me to make sure that you are getting what you need and doing what you need to be able to do that. Is there a way to do an online town hall where it's not a sales seminar? You can do that. I would highly recommend that you work with your upline compliance officer when you build out the content, because you do not want to make any mistake with what you're saying, and what that is. Laura, I am coming to Atlanta. I'm coming to Atlanta in March, and I'm coming to South Carolina in March. I have the South Carolina summit, and then I fly from South Carolina to Atlanta, and I do Georgia summit the next day. I want to say it's the 23rd, 24th, and 25th that I'm in Atlanta. So I will be in South Carolina and Georgia. Those were the other ones that I was forgetting. Thank you. And Jennifer Horn, thank you for saying that I've helped you understand this. That is my goal. If there is content, oh, and I will be in Columbus on February 3rd. So I'm coming down there as well. Um, so yeah, and DC. I did answer the CRM, it's agency block. If there are questions and things that you need, let me know. If there's content that you wish that I would have done that I haven't, let me know. I am all for going ahead and helping, and creating anything on the fly wherever possible. So, thank you. I am going to go ahead and stop the recording.